Hi, my name is Carly Heward, and I'm going to be discussing the opioid epidemic and its impact on rural America, particularly with the agricultural industry and farming communities. This crisis has had devastating effects across the country, but rural areas face unique challenges that make it harder to combat opioid addiction and its consequences. I'll walk you through the history of the epidemic, the key challenges in rural America, its impact on the agriculture industry, and what is being done both at the community and government levels to address this crisis. By the end of this presentation, I hope we all have a better understanding of the problem and how we can contribute to meaningful solutions. These are the table of contents, including the historical context of the opioid epidemic, the challenges in rural America, who exactly is being impacted, the national and regional data from the CDC, the impact specifically on the agriculture community and industry, the government and community responses, children in foster care, funding and policy challenges, future solutions and moving forward, and finally my conclusion. So to start off, the overview of the opioid epidemic in the U.S., you can see in this chart that the drug-related, let me zoom in so I can see it a little bit better, has increased from 2000 to 2020 from opioid addiction. The first wave began back in the 1990s when pharmaceutical companies aggressively marketed opioids like Oxycontin, leading to overprescription and widespread misuse. The second wave started around 2010 when heroin use increased significantly due to its affordability and accessibility compared to prescription opioids. The third wave began in 2016 with the rise of synthetic opioids such as fentanyl, which is far more potent and has been more responsible for a dramatic increase in overdose with these deaths. This timeline helps us understand how opioid misuse spread, particularly in rural communities where economic struggles and healthcare access gaps exacerbated the crisis. This also addresses what I just went over. I included a photo from opioids back in the day. I believe this is 1996. But yeah, so moving forward onto the challenges specifically in rural America. So why has the opioid epidemic hit rural communities so hard? First, prescription opioids were more available in these areas due to high rates of prescribing by rural doctors. Second, economic stressors like job loss, farm closures, and poverty have contributed to substance abuse. Third, rural communities and areas often lacked access to treatment and recovery services, making it difficult for those struggling with addiction to actually get help. And finally, there's a strong stigma around addiction in small, tight-knit communities, which can discourage people from seeking treatment. Who is being impacted? The opioid crisis is not just a statistic, it affects real people, families, and communities. Farmers and agricultural workers are particularly more vulnerable due to the physical demand of their work, leading to a higher likelihood of prescription opioid use for pain management. Families often suffer when addiction leads to financial hardships, job loss, and instability. Children are significantly impacted, with many being placed in foster care due to parental substance abuse, and overdoses have increased across all racial ethnic groups, but Black, Indigenous, and Hispanic populations face even greater challenges due to systematic healthcare disparities. So, moving on to the national and regional data from the CDC, let's look at some key data to understand the scale of the issue. So, according to the CDC, opioid overdose deaths have steadily increased over the past 2 decades, with rural communities being disproportionately affected. From 2019 to 2022, fentanyl-related deaths increased by 99%, methamphetamine-related deaths by 108%, and cocaine-related deaths by 69%. A shocking 3 in 4 farmers say it's easy to access opioids in their community. This data underscores the need for immediate action and targeted interventions. So, looking at the agricultural industry, the opioid crisis is not just a public health issue, it is also an economic crisis, especially for those within the agricultural sector. Farmers and ranchers rely on physical labor, and injuries are common, leading to higher opioid prescriptions. Opioid dependence has contributed to labor shortages in the agricultural workforce as workers struggle with addiction or leave the industry. This crisis affects food production, the rural economies, and overall the community's well-being. As for the government and community responses to this crisis, federal, state, and local governments have implemented various policies, but challenges remain. The federal government has funded treatment programs, prescription monitoring systems, and harm reduction initiatives. However, settlement funds for opioid manufacturers have not always been allocated effectively, with some states using them for unrelated projects instead of direct addiction treatment. Community-led initiatives have been more effective in many cases. Rural communities have started education programs, recovery support networks, and harm reduction strategies to reduce the stigma and provide resources for these people. As for the children in foster care, one of the most heartbreaking aspects of the opioid epidemic is its impact on children. In 2017, an estimated 2.2 million children had a parent struggling with opioid use disorder. Many children have been placed in foster care, have lost parents to these overdoses, or have been exposed to drug-related environments. If trends continue, 4.3 million children will be affected by opioids use disorder by 2030, with a projected lifetime cost of $400 billion. This crisis addresses the need for family-centered solutions, such as increasing support for affected children and expanding family access for family-based recovery programs. As for the funding and policy changes, a major obstacle in addressing the opioid crisis is the misallocation of these funds. While lawsuit settlements against opioid manufacturers have generated billions of dollars, many communities are not seeing these funds used effectively. Instead of prioritizing addiction treatment, some governments have redirected funds to law enforcement or unrelated projects. Transparency and community involvement are essential to ensuring that these funds make a real difference in affected rural areas. Moving forward to future solutions. So, what can be done to reduce the opioid crisis in rural America? First, increasing public education to reduce the stigma by raising awareness about addiction, its causes and treatment options can help reduce stigma and encourage people to seek help. There's such a negative stigma around the opioid crisis, which makes it hard for people to want to come to family or friends or anyone to help with their issue and essentially move forward to a better future for themselves and the people around them. Also, expanding access to treatment in rural areas. More healthcare facilities should offer medication-assisted treatment and mental health support. Improving prescription monitoring. Stricter guidelines can help prevent overprescription while ensuring patients with legitimate pain management needs are cared for. Next would be support economic stability. Job training programs and financial assistance can address the root of the cause of the substance abuse to begin with. And lastly, enhancing harm reduction strategies. Making Naxicone, also known as Narcan, more widely available and promoting safe disposal of prescription opioids can help prevent overdoses. As for my conclusion, the opioid epidemic has had a profound and devastating effect on these rural communities, particularly those in the agricultural sector. We need to recognize that the addiction is not a moral failing, it is a public health issue that requires compassion, education, and action. By working together through policy changes, community led efforts, and increased support for affected individuals and families, we can build a future where rural communities are stronger, healthier, and free from the grips of opioid addiction. Thank you so much for your time. I'm happy that I got to go over this issue, as it was very interesting to see all the different ways that it has an impact on different communities. And again, my name is Carly Heward. I'm a senior at Cal Poly studying agricultural communications, with hopes of pursuing more education in Germany or the Netherlands going into sustainable fashion and textiles. Thank you.